Have you understood? So the superior rectus muscle, in this diagram you can see superior rectus muscle, it is helping for the upward movement. Superior rectus muscle helping for the upward movement, the medial movement, the medial intorsion. These are the three movements which are helping by the superior rectus muscle. In the case of an abducted eye, it is only elevate. In the case of an adducted eye, it will only help for the intorsion. That's understood? Okay, now the next muscle is medial rectus. Medial rectus, listen, this is the medial rectus muscle. This is the position of medial rectus muscle. Medial rectus muscle, only one action in all position, that is medial rotation or adduction. Okay, it is helping for the medial movement of eye. Medial movement of eye towards nose, helping for the medial movement of eye towards nose. That is the superior rectus muscle, which is helping for the adduction along with the medial rectus muscle. Medial rectus muscle, only single action, the adduction, the movement of eyeball towards nose. Then the next muscle, the inferior rectus muscle. The inferior rectus muscle have got three actions. One, the depression, the downward movement of eyeball, depression. The other movement, adduction, the medial movement of eyeball, adduction. Extorsion. Extorsion means lateral rotation or that is movement towards opposite to medial rotation. That is extorsion. In an abducted eye, in an already laterally moved eye, the inferior rectus only do one action, like the superior rectus, ഏതായിരിക്കും? Depression. Only on the laterally abducted eyeball, the inferior rectus only will do depression. In the adducted eye, the inferior rectus, in the adducted eye, the inferior rectus only will do extorsion. Adducted means medially, already medially moved eye, isn't it? In case of adducted eye, it will only do the extorsion. So these are the movements of inferior rectus. Three different actions are there: depression, adduction, extorsion. In abducted eye, it will only depress. In an adducted eye, it will only move for the extorsion. The next muscle is lateral rectus. This is lateral rectus. Lateral rectus, like the medial rectus only abduct. Medial rectus only adduct. Like that, lateral rectus only abduct the eyeball. Only lateral movement. Lateral movement is the only abduction in all positions. Next, superior oblique muscle. Superior oblique muscle and inferior oblique muscle we will discuss after the discussion of its origin and insertion. Okay. So, once again I will explain forerecti muscle originating from a common annular tendon, the common annular tendon of Zinn. Insertion towards a sclera posterior to limbus. Limbus means sclerocorneal junction in front of equator of eyeball. All the recti muscles are separated by oculomotor nerve except abducens nerve. These are the common. This is the common tendinous ring. From the common tendinous ring, the superior rectus originating and inserting behind the limbus. The lateral rectus originating and inserting behind the limbus. Inferior rectus originating and inserting behind the limbus. The superior rectus originating and inserting towards a sclera behind the limbus. This is the This is representing the common tendinous origin. Common tendinous origin. This is superior rectus. This is medial rectus. This is lateral rectus. This is inferior rectus. This is superior oblique muscle. This is inferior oblique muscle. And this fifth one labeled, that is the levator palpebrae superioris. Understood?
Yes, ma'am.
This is the cavity that we have already discussed. This is the superior orbital fissure. This is inferior orbital fissure. And this one is optic canal in relation with the superior orbital fissure, and optic canal you can see the common tendinous ring. From the corresponding aspects of common tendinous ring, the muscles originating superior rectus from superiorly, medial rectus medially, lateral rectus laterally, inferior rectus inferiorly. Understood? This is the schematic representation to show the different positions of muscle: superior rectus, inferior rectus, medial rectus, lateral rectus, and superior oblique, inferior oblique. Superior oblique passes inside a pulley. Can you see the pulley? It passes inside a pulley before insertion. And this is inferior rectus acting in relation with the lateral rectus. Okay. So this is insertion, the distance of insertion of each muscles from the limbus. These are the muscles innervated by the nerves. The oculomotor nerve, third cranial nerve, supplies the superior rectus, medial rectus, inferior rectus, and the inferior oblique muscles, where the lateral rectus is supplied with the abducen nerve, superior oblique is supplied with the trochlear nerve. Nerve supply all the four recti muscles: medial, superior, inferior, all the three recti with inferior oblique supplied with oculomotor nerve. Trochlear nerve supplies the superior oblique muscle. Abducen nerve supplies the lateral rectus. These are the actions. The superior oblique in primary position, depression, abduction, intorsion. In an abducted eye, only intorsion. In the adducted eye, only depression. Inferior oblique muscle, elevation, abduction, extorsion. Abducted eye, only extorsion. Adducted eye, only elevation. Inferior rectus have got three functions: downward movement, medial movement, and extorsion. Only depression in abducted eye, only extorsion in adducted eye. Superior rectus three movement: upward, medially, and intorsion. Abducted eye movement, elevation. Adducted eye movement, only intorsion. Medial rectus and lateral rectus, depending upon the position, medial rectus abduct the eye, medial rectus adduct the eye, lateral rectus abduct the eye. Understood the individual muscle actions?
Yes, ma'am.
So that is the movement. You can see if this is your medial aspect of your eye. If this is the medial aspect of your eye, the medial rectus helping to move medially. Okay, medial rectus helping to move. This is the abduction and adduction. Adduction means lateral movement. You can see this caruncle, lacrimal caruncle, isn't it? That is the major feature which can be seen at the medial angle of eye. So towards medial angle, the eye moves towards medial angle with the help of medial rectus, and towards the lateral angle with the help of lateral rectus. That is towards nose by means of medial rectus, towards temple region by means of, away from the nose by means of lateral rectus. That is abduction and adduction. So that is about the recti muscle. Hope you have understood. Being an essay question, I am explaining this much. You might have get bored, isn't it? Have you understood the recti muscle for recti, commonly originating from common tendinous ring, inserting towards sclera? That's a point. Have you understood?
Yes, ma'am.
Okay. Now oblique muscle, the superior oblique and inferior oblique muscle. The superior oblique muscle, as I have told you earlier, it is originating from the bodiosphenoid supromedial to optic canal. We have seen the optic canal now, isn't it? Optic canal that is presenting medial to superior orbital fissure. So, supromedial to optic canal from the bodiosphenoid, that is the origin of superior oblique muscle, insertion to sclera behind the equator between the superior and lateral rectus. Insertion to, so this is the muscle superior. Can you see the superior oblique muscle? This is superior oblique muscle. Superior oblique muscle is the muscle which is originating from the sphenoid. It is originating from the sphenoid in relation with the optic canal and passes through a trochlea, a fibrocartilaginous pulley, and inserting in between the superior rectus and the lateral rectus, in between superior rectus and lateral rectus. So that is the superior oblique muscle. So superior oblique muscle originating from sphenoid, inserting to sclera. Understood? The tendon passes through the fibrocartilaginous pulley attached to trochlear fossa of frontal bone. Attached to trochlear fossa. Can you see in this diagram? The green colored superior oblique muscle originating from sphenoid, inserting towards the sclera after passing through a fibrocartilaginous pulley which is attached towards the trochlear fossa just below the superior orbital margin. On the medial aspect you can see a depression, that is a trochlear fossa, superior trochlear fossa, supratrochlear fossa, to which there is the fibrocartilaginous pulley attaches and inserting the superior oblique muscle towards the sclera in between the superior and lateral rectus. Understood? It is nicely visible, isn't it? And the nerve supply already we have discussed. The trochlear nerve, the SO4, fourth cranial nerve, action, depression, abduction, intorsion. Depression, downward movement, abduction, lateral movement, intorsion, inward, medial inward movement. This is how appears. It passes through the fibrocartilaginous pulley. Next muscle is inferior oblique muscle. Inferior oblique muscle is the originating from the orbital surface of maxilla. It is originating from the orbital surface of maxilla. A rough impression at the anteromedial angle of floor of orbit lateral to lacrimal groove. The insertion is sclera. Insertion towards the sclera. Lacrimal groove we have seen in maxilla, and we know what is the orbital surface of maxilla, isn't it? It is inserting to the sclera behind the equator at the postero-superior quadrant of eyeball, just below and posterior to insertion of superior oblique muscle. It is inserting just behind or posterior to insertion of superior oblique muscle. Action, extorsion, elevation and abduction. Action, extorsion, elevation and abduction. Extorsion is outward movement, elevation is upward movement, abduction is lateral movement. So can you see the inferior oblique muscle in green color? The inferior oblique muscle from the floor of the orbit to the, it is inserting from the floor of orbit in relation with the lateral rectus to the insertion of superior oblique. And superior oblique in the insertion vary. അതുകൊണ്ടാണ് നമ്മൾ ആ സ്കീമാറ്റിക് റെപ്രസെൻറ്റേഷൻ വരച്ചപ്പോൾ ലാറ്ററൽ റെക്ടസിൻ്റെ അടുത്തുനിന്ന് തന്നെ രണ്ട് മസിൽസും വരുന്ന പോലെ കാണിച്ചിരുന്നത് ആ ഡയഗ്രത്തിൽ. ശ്രദ്ധിച്ചിരുന്നോ നിങ്ങൾ? ഇൻ ദിസ് ഡയഗ്രാം see, how we say this? Superior oblique which is attaching like this. And superior oblique and inferior rectus. In relation with the lateral rectus, it is inserting. So that is all about the muscles. Now you can see the inferior oblique like this. Inferior oblique supplied with, what is the supply of inferior oblique? The nerve supply is same with oculomotor nerve. Now the last muscle, the seventh muscle is the levator palpebrae superioris. The levator palpebrae superioris muscle. Levator palpebrae superioris muscle, it is originating from under surface of lesser wing or sphenoid. You have studied about the sphenoid, you know what is lesser wing or sphenoid, isn't it? Do you know the lesser wing or sphenoid? Okay, greater wing or sphenoid, lesser wing or sphenoid, and body of sphenoid you have studied in sphenoid, isn't it? So
Yes, ma'am.
from the under surface of lesser wing or sphenoid, this is originating. The levator palpebrae superioris is originating from the under surface of lesser wing or sphenoid above the common tendinous ring. Above the common tendinous ring by a narrow tendon which forms three different stratas or lamellae. Three different stratas or lamellae can be seen in relation with it. What are the different lamellae? The superior layer, the deep layer, inferior layer. Three layers can be seen. They are superior lamella or the upper lamella, intermediate lamella, and the lower lamella. The superior lamella is inserting to the skin of upper eyelid. Superior lamella inserting to the skin of upper eyelid. It penetrates the orbital septum, passes through the orbicularis oculi, and inserting to the skin of upper eyelid. That's why it is helping to move the upper eyelid. Then the intermediate lamella, it forms the continuation as the superior tarsus muscle of upper eyelid. It is forming the superior tarsus muscle of upper eyelid. I have already told you superior tarsal muscle of upper eyelid, the Muller's muscle, is the extension of levator palpebrae superioris, isn't it? That we have studied. So that is intermediate lamella forms the Muller's muscle, which are inserting to upper margin of superior tarsal plate, which is inserting to upper margin of superior tarsal plate is a fibrous plate which can be seen inside the upper eyelid. Lower lamella passes to superior fornix of conjunctiva. In eyeball, we have studied when we have studied about, not in eyeball, when we have studied about the lacrimal apparatus, we have studied the conjunctiva, isn't it? External covering of eyeball is known as conjunctiva, isn't it? That conjunctiva flips or it bends at an upper and lower angles to form the superior fornix and the inferior fornix. So, superior angle is known as the superior fornix, inferior angle is known as the inferior fornix. So, the lower lamella of levator palpebrae superioris muscle is inserting to superior fornix of conjunctiva. So, the levator palpebrae superioris muscle have got three different lamellae. One inserting to upper eyelid, skin of upper eyelid. Second, inserting to the fibrous basis of upper eyelid. Third, it is inserting towards the superior fornix of conjunctiva. Together, all this acting to upward movement of or opening of upper eyelid. The nerve supply, same with third cranial nerve or the oculomotor nerve, action elevation of upper eyelid. Have you understood? So I will show you the diagram. This is the muscle levator palpebrae superioris. This is only the position. We can't show the insertion because being it is present inside the upper eyelid. This is the position of levator palpebrae superioris. Understood?
Ma'am. Yes, ma'am.
So movement of eyeball we have studied. There is elevation, depression, adduction and abduction with the help of recti and oblique muscles. In a 12 o'clock position, superior rectus upward, medially and upward, it is helping for the upward movement, medially rotate, the adduction and the മറന്നുപോയോ superior rectus എന്തൊക്കെയാ ചെയ്യുന്നത്? Tell me.
Elevation, intorsion,
Intorsion, isn't it? Inward movement, intorsion. medial rotation or inward movement. Then medial rectus helping for the adduction. Inferior rectus helping for the
Depression, adduction, extortion.
depression, adduction and extorsion. Okay, then superior oblique muscle.
Adduction, depression, abduction, and intorsion.
Depression, abduction ആണ് ട്ടോ, adduction അല്ല, abduction and intorsion. ആരോ adduction ഇടയ്ക്ക് പറഞ്ഞു. Then inferior oblique,
Extortion, elevation, and abduction.
elevation, abduction and extortion. Very good. Then the medial and lateral rectus.
Medial adduction, lateral rectus, abduction.
Okay, മനസ്സിലായല്ലോ. Conjugate movement, that is associated movement, right and left eye together moving, isn't it? അതിനെയാണ് നമ്മൾ associated movement അല്ലെങ്കിൽ conjugate movement എന്ന് പറയുന്നത്. Okay, so conjugate movement when both eyes move in same direction with their visual axis being parallel to each other, then it is named as conjugate movement. Disconjugate movement means that is a convergence or divergence of the movement, that is not moving together, that is disconjugate movement. Two types of associated movements, that is right and left eye, that is in right and left extraocular muscles are acting independently with the right and left oculomotor nerves and different muscles, isn't it? But together it produces a vision. That typical vision is produced by means of associated movements or conjugate movements. Sorry, the conjugate movements are moving along with it side to side, where disconjugate movement, that is convergence or divergence. Okay, then involuntary extraocular muscle. I have told you the in the group of extraocular muscles, voluntary muscles are more important. Voluntary muscles are more important. Involuntary muscles are also there. They are superior tarsal. They are superior tarsal muscle, inferior tarsal muscle, and orbitalis muscle. Superior tarsal muscle, it extends from the intermediate lamella of levator palpebrae superioris to the superior tarsal plate. The inferior tarsal muscle, it extends from the fascia of inferior rectus and oblique muscle to the inferior tarsal muscle or tarsal plate. Then last one is that the superior tarsal muscle can be seen on the upper eyelid, inferior tarsal muscle can be seen at the lower eyelid. Orbitalis, that is a fibers, collection of fibers, few muscle fibers bridging the inferior orbital fissure. It can be seen over the inferior orbital fissure, that is the orbitalis muscle. Nerve supply means all the three muscles are separated by the post-ganglionic sympathetic fiber, that is autonomic fibers, autonomic nerves. The post-ganglionic sympathetic fibers from superior cervical sympathetic ganglion. Superior cervical sympathetic ganglions are the nerve fibers which are responsible for the involuntary movement of the muscles, involuntary extraocular muscles, namely superior tarsal or the Muller's muscle, inferior tarsal muscle and orbitalis muscle. Understood?
Yes, ma'am.
Applied anatomy. This is squint, can be lead to diplopia, double vision. That is unilateral paralysis of individual muscle with involvement of corresponding nerve produces the strabismus. It is named anatomically, it is named as the strabismus, or commonly it is named as the squint. That is which loses the conjugate movement. That is the meaning. ഏതെങ്കിലും ഒരു മസിലിന് പാരലൈസ്ഡ് ആയാൽ നോർമലി ഒരു മസിൽ ഫങ്ഷൻ ചെയ്യും, the other muscle will not function along with it. So adana specially named as strabismus. Another thing, the levator palpebrae superioris. Any Paralysis of levator palpebrae superioris lead to ptosis, drooping of eyelid. It is otherwise named as a drooping of eyelid. The paralysis of levator palpebrae superioris, that is upper eyelid muscle, can be lead to unopposed action. We can't open the patient cannot open their upper eyelid, forming the ptosis or drooping of eyelid. Now, in this chapter, there is an important uh, topic, which is your 3-mark question, important 3 marks question. That means in Norma basalis, we have studied different view of skull, isn't it? We have studied different view of skull. In that, there is the presence of uh, Norma frontalis, anterior view. Norma occipitalis is the posterior view. Norma lateralis is the lateral view. Verticalis is the superior view. While in basal view is the Norma basalis, isn't it? Inferior view or from below. In Norma basalis, we can see a number of openings in anterior cranial fossae. In the next class, you will study about the anterior cranial, posterior cranial and middle cranial fossas. That is the cavities which can be seen inside the base of the skull. So, in there are some openings like the foramen magnum. You might have heard this foramen magnum, isn't it? There are large and small openings which can be seen in the base of the skull for the passage of nerves and vessels from interior of skull to externally, from external to interior of the skull. So, there are some structures which are named according to its position. There are some openings, a number of openings can be seen. So, out of which one important opening is the superior orbital fissure. Superior orbital fissure is one of your important questions. It will ask, most of the times it will ask the superior orbital fissure. Superior orbital fissure. Superior orbital fissure is an opening. We have seen the superior orbital fissure in that diagram, isn't it? So this is the schematic representation showing the superior orbital fissure. Can you see the diagram?
Yes, ma'am.
Okay. So listen. This is present in sphenoid bone. Okay. This opening, only superior orbital fissure have shown in this picture. In that bony orbit, we have seen a cavity extending from this laterally, that is inferior orbital fissure, isn't it? This is superior orbital fissure only. Okay, the superior orbital fissure is present in the sphenoid bone. The boundaries, I will tell you, this is the cavity, isn't it? That white colored you can see in this, that is the cavity which is named as the superior orbital fissure. It is bounded by above lesser wing of sphenoid. This is lesser wing of sphenoid. Above lesser wing of sphenoid. Below greater wing of sphenoid. Below greater wing of sphenoid. Medially the body of sphenoid. Can you see the diagram? Above the lesser wing of sphenoid, below the greater wing of sphenoid, medially by the body of sphenoid. These are the bony elements bounding the superior orbital fissure. So there is a slit-like cavity. You might have studied in the sphenoid bone, isn't it? Have you studied the superior orbital fissure? Tell me, say so, no.
Yes, ma'am.
Have you studied the superior orbital fissure in sphenoid?
Ma'am, maths in 11th.
Superior orbital fissure.
11th. Okay. Sphenoid.
Have you studied the sphenoid? Have you go through the classes of sphenoid? Have you got the classes of sphenoid?
Yes, ma'am.
Who taught you? Me? No, it's okay. Don't tell the name. I'm asking you. Uh, have you studied the sphenoid? Have you go through the portions? What you have got lessons about it? Have you go through it? No.
No, ma'am.
Okay. So have you heard the term of superior orbital fissure in sphenoid? So you know you have studied the structures passing through it. Sure. Okay, listen, students. I will tell you. Listen. So three major parts of the sphenoid are the bodiosphenoid, lesser wingosphenoid, and greater wingosphenoid. Okay, lesser wingosphenoid is forming as the anterior extension, which can be seen from the frontal bone, isn't it? That is continuing with the frontal bone and crista galli, all those things we can see. You might have seen that position. That is lesser wingosphenoid. Have you seen this hypophyseal fossa? Have you seen the hypophyseal fossa in sphenoid?
Yes, ma'am.
Okay. Hypophyseal fossa can be seen on the superior surface of sphenoid, isn't it?
Yes, ma'am.
On the superior surface of sphenoid, you can see the hypophyseal fossa. So, the medially hypophyseal fossa, anteriorly lesser wing of sphenoid, and if we are looking superiorly, we can see the cavity. Where should be the cavity? I will tell you. That is the position of the cavity is like this. I will show you the diagram in, I think it is there in, uh, can you see this? Not in this. Can you see this? Okay, in this diagram you can see this is the superior orbital fissure. Can you see the superior orbital fissure here? This is a superior orbital
Yes, ma'am.
fissure. Okay, so this is forming the body of, this is forming the, uh, listen, this is forming the lesser wingosphenoid. This is forming the greater wingosphenoid, and here forms the bodiosphenoid. Understood? So this is the position, and we can see the optic canal also. So uh, wait, I will show you the diagram.